Hi, my name is Dr. Parakrama Dharmaratne. I'm an orthopedic surgeon working in Sri Lanka. My special interest areas are shoulder-related injuries and knee-related injuries whilst I practice on other parts of orthopedics. Today, we are going to discuss about common shoulder injuries that happen in individuals and how to go about managing them. Let's have a look at the anatomy of the shoulder before we start. Looking at the anatomy of the shoulder joint, it comprises of few bones, few tendons and few muscles around it. So all of these structures are commonly injured during day-to-day life. This long bone is called humerus or otherwise the arm bone. This is clavicle and this is the wing bone. So these structures are articulated in such a way to allow us to have a wide range of movement in the shoulder joint. So bones move the arm around and that is aided by the muscles and the tendons around it. Sportsmen who are involved in contact sports as well as racket sports, shoulder injuries are very common. So it starts from bone injuries where you can have fractures of the bones. So humerus fractures, clavicle fractures, fracture of the wing bone, these are also quite common. But if you really look at it, I get most of my patients coming with, young individuals coming with shoulder joint dislocations, because to allow a wide range of mobility, shoulder has become quite unstable, that is inherent. So anterior dislocation or dislocation to the front of the shoulder is the most common injury. Then backward dislocations are common in electrocutions and people who have epilepsy, but inferior and superior dislocations are very rare. So let's talk about anterior dislocation first. So commonly when your arm goes outwards and backwards, so abduction, external rotation movement is the commonest mechanism of injury or dislocation of the shoulder. And with the dislocation of the shoulder, there is a brim of tissue around the socket in the shoulder which tears off, and then that will never heal or come back to its own position if we leave it alone. So in younger people who are around 20 years of age, the books say the redislocation rates are about 95 to 100%. First dislocation at the age of 30, 35, redislocation rates are about 60%. And 40 plus age, redislocation rates are 40% or less than that. So younger you are at your first dislocation, higher the chance of redislocation rates. We have to discuss about the individual's requirement when the patient comes to us after an injury, whether the patient is in a contact sport or whether the patient is involved in a racket sport. So our treatment modalities depend on the requirement of the patient. So if I talk about a cricketer who has overhead throwing action, or a swimmer or a tennis player, they will need a wide range of movement. So if we restrict that range of movement, their whole action, throwing action, bowling action, all that will change. So in such individuals, I prefer to do an arthroscopic repair of the torn labrum. But in a contact athlete, mainly rugby, for them, they need a very robust shoulder which would never dislocate again. So they can sacrifice a little bit of mobility to get that stability. So such individuals, I do a surgery called Latarjet surgery. This is an open surgery, but it gives a very high stability to shoulder joint. That is about younger individuals. So dislocations are common in younger individuals. And then when it comes to older individuals, after a fall on outstretched hand, those who are 40, 50-year-olds, they have a tendency to tear these muscles called rotator cuff muscles. So those are the muscles which aid the shoulder to abduct, extend, rotate and pull backwards. So out of these muscles, the muscles that abduct the arm and externally rotate the arm are quite important, and if it is torn, it causes a lot of debility. So such individuals also require surgical intervention. So these are nowadays performed under arthroscopic or keyhole camera guided surgeries. While we offer a camera guided surgery, we can also do these by open methods, but camera guided surgery recovery is faster and return to sports, return to normal life is faster than open surgeries because the convalescence period is minimum. If we talk about another common soft tissue injury, that is acromioclavicular joint dislocation. That's commonly seen in, again, young athletes who are in contact sports. This has various grades, grade 1 to 5. So grade 1, 2, we do not need to treat those people. We can just manage conservatively, manage the pain, leave the arm in a sling and then allow it to heal on its own. But if the clavicle is dislocated off from the acromion quite prominently and the individual is feeling crepitus, and if there is a lot of movement around this region, that needs to be tied down in its original position. So that is called acromioclavicular dislocation, which is another common soft tissue injury along the shoulder joint. And the other possibility is rupture of the bicep tendon. It can be rupture inside the shoulder joint with the attached labrum or rupture outside the shoulder joint. So that is when you get that Popeye bulge. If you remember younger days, you look at that, watch that cartoon Popeye. So that kind of appearance will come on the forearm. So that is another soft tissue injury which can be again arthroscopically, that is camera guided repair can be offered. Fractures around the shoulder, humerus fractures, clavicle fractures, these are also common bony injuries with in relation to sports. So such individuals, we have a wide variety of surgical options that can be fixed with titanium plates, and then return to sport is quite quick if we offer them quick treatment.